Skip the DAST-10 drug abuse screener, and your read on a client's drug use stays subjective. And at intake, subjective is where you miss things. What you observe in a client is largely subjective. You're human, you miss things and you misinterpret things. A validated screener gives you something to quantify. The DAST-10, the drug abuse screening test, is one of the validated clinical measures built into Behave Health's addiction treatment EHR. Here is how the DAST-10 fits with the other clinical measures your addiction treatment center uses, and where it lives inside the platform. The DAST-10 is the drug abuse screening test, a validated clinical measure for quantifying a client's condition, rather than relying on impression alone. Clinical quality measures, often called clinical measures, help you quantify a patient's condition and track treatment success. They are far from perfect, but they beat subjective observation. The DAST-10 sits alongside measures like Audit C and the Brief Addiction Monitor, the screening tools an addiction treatment center reaches for at intake and beyond. Addiction treatment is moving from fee-based care to value-based care, where outcomes have to be tracked meticulously, and impression alone will not hold up. The industry is beginning to move from fee-based care to value-based care, where reimbursement follows documented results, not just services rendered. Without a validated screener captured at intake, you have nothing to track progress against, and meticulous outcome tracking is exactly what value-based care demands. Behave Health includes 12 clinical measures built into its all-in-one addiction treatment EHR and CRM. The DAST-10 among them, designed so a center can screen without bolting on extra tools. The DAST-10 is one of 12 clinical measures embedded in the app, so the screener your team needs is already there, rather than stitched together from elsewhere. Because Behave Health's tools are stored in the cloud, every clinical measure is designed to be completed by your clients on the device of their choice. Before the full list, here are 3 of the clinical measures an addiction treatment center leans on most. The company the DAST-10 keeps at intake: anxiety, depression, and substance use disorder severity. Let us walk through all 3. Measure 1. The GAD-7, a 7-question test clients fill out to gauge the severity of their anxiety. GAD-7 stands for Generalized Anxiety Disorder 7. It screens for nervousness, excessive worry, restlessness, and an overall sense of dread. It cannot diagnose, but it tells you whether to refer for clinical assessment. Many addiction treatment patients score high, so it is worth running on every intake. Measure 2. The PHQ-9, a 9-question depression screening tool that takes less than 3 minutes. You have likely seen the PHQ-9 at a primary care office, where it is widely administered. It is fast and familiar. Unlike the GAD-7, qualified clinicians can use PHQ-9 results to make a depression diagnosis and classify severity from none to severe. Measure 3. The Brief Addiction Monitor, a 17-question measure of substance use disorder severity and relapse risk. The BAM is administered several times throughout treatment to measure progress, asking things like confidence in staying abstinent over the next 30 days. The BAM is widely used in the VA to measure treatment outcomes for veterans. Its track record makes it a must-have at an addiction treatment center. Beyond those 3, here's the rest of the library. 12 clinical measures available on the Behave Health app, with the DAST-10 included. The DAST-10 drug abuse screening test, Audit C, the PHQ-15 for somatic symptoms, and the major depression inventory. The PTSD checklist civilian version, the ACE score, the Altman self-rating mania scale, the addiction severity index, and the panic disorder severity scale, together with the GAD-7, PHQ-9, and Brief Addiction Monitor. That is the full set of 12, likely covering the specific measure your center needs. Behave Health is designed so the clinical measures your team relies on are embedded in one all-in-one EHR and CRM, not scattered across separate tools. The clinical measures are embedded directly in the app, part of the same EHR and CRM your addiction treatment center already runs on. Because everything is in the cloud, clients can complete a measure on the device of their choice, designed to make intake screening simpler to administer. Stop relying on subjective impression for drug use screening. See the DAST-10 and 11 more clinical measures in a demo at behavehealth.com. Start a free trial or book a demo to see the DAST-10 and the full clinical measures library at behavehealth.com.